Hello everyone. Today I will be presenting on advanced care planning and why it is important for the future of your healthcare. Here's a little snapshot of the agenda of this presentation. We'll start off with an introduction, then we'll talk about choosing a decision maker, then we'll move on to finances and insurance, and then lastly we'll talk about living arrangements. To start off with a little introduction about myself, I am a registered nurse here in the state of Iowa. I have 11 years experience with caring for the elderly, and that's a mix between long-term care and psychiatry. And the reason why I chose this topic to present on is I have seen very many patients and families struggle with obtaining end-of-life care um, that they want. So, what is advanced care planning exactly? It is the process in which you plan for what the future of your healthcare will look like. Um, it involves choosing a decision maker or a durable power of attorney and creating a living will. There's also some financial planning that needs to occur because healthcare is expensive and you do not want to get caught in a situation where you are unable to afford the level of care that you require. And then it is also important to look at um, future living arrangements so you can pick somewhere to live out the end of your life comfortably. So, what goes into choosing a decision maker? Ideally, you want to choose someone who you trust and that knows you very well, and that you know will always have your best interests in mind when it comes to making decisions on your behalf. Once this person is selected, you fill out the DPOA forms, which is a legally binding document that uh, appoints this person as your healthcare decision maker. Um, you can also have both a healthcare decision maker and a financial decision maker. So one person isn't having to do both jobs. Um, this is important because it ensures that you have someone that you trust lined up already, and it also leads to less confusion within the family of who should be calling the shots on your healthcare decisions. A living will is a legally binding document that clearly states your wishes. It helps guide your decision maker and healthcare professionals through your end of life care. And it allows you to continue to have a say in your end of life care even after you are no longer able to make decisions. Um, the QR code on this slide links to the AARP website and has all the advanced directive forms by state that you are able to fill out. Moving on to insurance and finances, healthcare is expensive, as everyone knows, and it is continuously getting more expensive as time goes on. There's a lot of misconception of what Medicare covers. I think a lot of people are under the assumption that once they're over 65 and get on Medicare, that their long-term care expenses will be covered. However, that is not the case. Medicaid uh, requires the exhaustion of your savings and assets before you are able to qualify. Um, and the other option is long-term care insurance, which is already expensive and premiums are continuing to rise. Another note about long-term care insurance is there's usually a 90-day waiting period from the day that you start receiving care till when coverage kicks in. Next, we will go through the different living arrangements during end of life. We'll start off with home health care. This is generally a lower level of care where you might have a nurse or nursing assistants come in a couple times a week to help uh, with showering, cooking, medication management. This is also not always covered through insurance, which is unfortunate. Next up, you have your independent and assisted living situations. This is usually a small apartment that you move into, and there is some nursing care that you that will be provided on request. Again, these are not always covered through insurance, and then the nursing care that is involved is usually simple, medication management. They might provide a meal or all meals throughout the day, um, but any further or higher level of care will still require you to go to the hospital normally. Next up is intermediate care facility. So this is what we generally think of when it comes to nursing homes. This is also known as ICF level of care. So this is a higher level of care than assisted living. There's generally 24-hour nursing services provided. Typically, all meals are provided. Nurses are there to assess you. They will pass all your medications. This is generally covered through Medicaid. Again, you to qualify for Medicaid, you usually have to have a limited number of assets. This varies state by state. And then this is where long-term care insurance can really help you pay for this level of care. And then lastly, I'd like to cover skilled nursing facility or SNF. This is generally the highest level of long-term care. Medicare does provide some coverage. This is usually limited to so many days in a year. Um, and this is a temporary level of care. And the goal is usually to return you to a baseline level of functioning. And then to kind of summarize what we went over in this presentation, advanced care planning can help you live the life the way you want to. It can take the burden of making difficult decisions off your loved ones and family. It may prevent lengthy hospital stays and unnecessary medical procedures that go against your wishes. And it helps give you the peace of mind that you will be able to leave something behind for your loved ones through the financial planning and ensuring that uh, your future care will be covered through insurance. Thank you for taking the time to review this information with me. This QR code on the slide is a link to a Qualtrics survey just to kind of get some information on what people think of advanced care planning and where they're at in this process. Also, in the description of this video is a link to a trifold brochure that uh, anyone is free to use if you would like to pass this information on to others. Also, share this video if you found it helpful and know someone who might also need this information. Thank you very much.